macroscopic level, they exist to kill. They travel, they attack, they hide, they even gather together in defense maneuvers. Pathogens are the enemies of every member of the healthcare team. On Pathogens and PPE, we give you the tools you need to fight these threats and win. So sit back, tune in, and let's make these microbes tremble at the sound of your name.
Hey everyone, and welcome back to episode 7 of season 2 on Pathogens and PPE podcast. I'm Jill Holdsworth, your host, and we will be diving into best practices in the decontamination area today. Don't go anywhere. We will be right back after a word from our sponsors. Welcome back to episode 7 of season 2 on Pathogens and PPE podcast. My name is Jill Holdsworth, and I am an infection preventionist in Atlanta, Georgia. And I am joined today by my co-host, Michael Matthews. Hey, Mike, how are you doing today?
Hey, I'm doing good, and I could not be more excited to be here. I'm a big fan of the podcast, big fan of yours. And so this is a lot of really cool things happening here. And I'm a clinical education specialist with Healthmark, and like I said, just thrilled to be here.
Well, I am also one of your biggest fans, so I'm kind of fangirling having you as my co-host today. So this is super cool for me too. We have a really cool episode today on best practices in the decontam area, and we have 3 really cool guests today for you, and I'm going to give them a chance to tell you a little bit about themselves, and I'm going to start with Jake.
Hey, Jill. Hey, everybody. So I'm Jake McHugh. I work for Agility and been doing that for quite a few years. Agility does a lot of things, especially instrument repairs, sterile processing education and in-services. And with them, I am a clinical education and training specialist. So love going into hospitals and helping people build better processes.
Great. Happy to have you here today. Trevor, why don't you go next?
Yeah, thanks so much for having me, Jill. It's an honor to be here with you and everybody else today. My name's Trevor Hazen. I am with H&M Medical. I serve as their clinical resource director, so do a lot of the education and marketing things for H&M. And if you're not familiar with us, we offer high quality, single-use instrumentation, not the plastic, flimsy, low quality stuff that most people associate with single use, but really high quality German grade stainless steel for single use instruments.
Thank you. And one of my favorite people, Katie.
Hello, everyone. Thank you so much for including me. I'm a statewide infection preventionist focusing in SPD, HLD, and surgery.
Thank you guys so much for being here. So let's kick it off by talking about how complicated the decontam areas can get. And being that it can get so complicated and crazy in decontam, why is it so important that we have standard work and follow the IFUs in these areas? And let's just start it back off with Jake.
Thanks. So yeah, it can get really complicated in decontam, and a big part of that is that all of the devices from all the services that are ongoing are going to flow through that area of the department, and staff really need to be aware of the proper decontamination cleaning process. If they're not, then they could not only damage the instruments themselves, but they may even miss something, which then gets to assembly and hopefully not, but to the next patient. And since all these instruments are so complicated, there has to be a way to get that information to the technicians.
Yeah, Jake, you're absolutely right. It is that there is a confluence of these instructions, right? Because it's not just all these instruments from all these different specialities. It's that you've also got instructions for use for the chemicals that you're using, and you've got instructions for use for the ultrasonic, and you've got instructions for use for the washers. And it's like you've got all of these things that are supposed to kind of line up and coalesce with each other, with the technician kind of at the head there. But the reality is that without that proper training to know all of these things, which is a lot, and the fact that sometimes all of these IFUs can and do contradict each other, we have a recipe for a lot of very difficult asks of the people in decontamination. You're absolutely right. When mistakes happen in decontamination, when things get missed, when those IFUs aren't followed, it then increases the likelihood that it's going to make it to the patient. And so when it comes to communicating those IFUs and doing that training, I'm curious if anybody on the team here has good experience with kind of upping the training level of the technicians there in decontamination.
I do have a little bit of an example for that.
Great.
But all excellent points of that. You definitely hit on those, not only the instruments themselves, but the equipment. So one of the big problems I do see is that a lot of new technicians coming in, some hospitals will kind of throw them to decontam. Just to be like, well, you'll get to see the instruments and see what comes down, but they can really be at a loss without that proper training. So not only as a part of your onboarding program for technicians, partnering with a specialized technician who's very familiar with decontamination and the equipment they'll be using. But if you have an electronic tracking system, there are certain modules to put notes, pictures, PowerPoints looped in with those sets. So anytime they scan something they're going to clean, the information can be at their fingertips. And that's probably the best tool that I've seen utilized.
Excellent. Yeah, I think you're absolutely right. A lot of times we look at decontam as like, just throw the newbie back there. And because all you got to do is spray it down with some water, soak it for a while, and throw it in the machine and hitting a button, right? How hard can it be, right? And when we have that view of decontamination and we don't appreciate the complexity, the outcome is exactly what you just described.
If I could add too, I feel like starting a tech off in assembly prior to going to decontam helps quite a bit too, because then they can see how the instruments are put together and how they should look when they're processing them through decontam. And I know people have strong feelings on that because I've seen places that do start techs off in decontam, but if you start back there, then you don't know how things are supposed to look when you're sending them through.
That's really good.
Yeah, that's a really great point. And it's actually quite frightening to me, as you guys are talking about this, to hear that new techs are just thrown into decontam, whereas there might be some rhyme and reason behind that. Like, yeah, you need to start where the instruments start, but that's one of the most important places in SPD, because if it goes wrong in decontam, then it goes wrong all down the line. So yeah, that's a little scary to me. Trevor, what do you think?
Yeah, I think it's super important to follow the IFUs. That's the source of truth. That's what needs to be happening each and every time. And so, in certain facilities, you may have the resources, the technology, the bandwidth, the staffing to be able to have a nice on-ramp for your team or for the new people. But I think there's also times where you're just kind of thrown into it, sort of on the job training, and you're just talking about what needs to happen. And how confident are we in, John Doe's memory of that IFU, of every single IFU for, like you said, Jake, all of the different types of instrumentation that's coming through. So it's very important to be able to have access to those IFUs, I think.
Now let's talk real life when we're talking about these IFUs. I know we all feel very strongly the IFUs need to be followed, but let's talk real life. How on earth are people supposed to look at the IFUs for every single thing that they're doing? And these IFUs are very complicated. So let's just kind of step into their shoes for a moment. We've all been there at some point. How are they supposed to follow these complicated IFUs that do them no favors?
Well, I think it's really important on the front end for the leaders, and if there's any instrument specialists involved in the process of getting instrumentation or equipment in, to make sure they're doing that on the front end and working with supply chain to vet these products. Is it something that's even realistic that the staff can process, or are we going to bring an item in first and then worry about how we're going to process it later and need to educate on the back end where we're setting everyone up for failure? So I think it starts before we even get equipment and instrumentation in, that we need to look at those and not rely so heavily on once it's in, trusting that technicians are going to look at it.
Yeah, and I cannot possibly agree with that more, that if we're expecting the technicians in the heat of the moment in decontamination to make those sort of critical, decisions, then we have already failed at that point. And so you're absolutely right that sorting through the IFU and kind of simplifying it, looking at the critical information and making sure that it's digestible, that's not the responsibility of the individual in decontam in the moment. That's the responsibility of the leadership way before that those materials actually make it to decontamination in the first place. And so, that is an absolutely excellent point.
And as an IP, I would also like to put in there that IP really should be reviewing these IFUs as well. I can't tell you how many times scopes were brought in or some sort of impossible to clean instrument. And then once it was put into use and we couldn't get it cleaned and we reviewed it after the fact, we would say, this is almost impossible to clean, or we don't have the right whatever to clean this thing. So that's why it's really important to involve your infection preventionist on the front end as well.
And I think that's an incredibly common experience in sterile processing. Like anybody who has worked in sterile processing for any amount of time has had the experience of a new device just showing up, and sometimes it's dropped off by a rep, and the rep says, just clean it the way that you clean everything else. And the technicians are like, okay, I guess, I don't know. And before you know it, you're using a device on a patient that was not cleaned or sterilized properly.
I was just going to kind of loop around there for, you try and set up a standard practice for all of your in-house instruments, and then a vendor comes in with 20 loaner trays. Maybe they have the same IFU, maybe they don't.
Yeah, and again, like if you're expecting the person in decontamination to stop the line and, evaluate that IFU and it's just not going to happen. And so I think that, again, this goes back to the original point that everything that goes through our department has to go through a vetting process on the front end. And of course, obviously, IP needs to be a part of that vetting process so that we can set those technicians up for success in the first place.
Yeah, I think one other thing about the deviations is just lack of time, lack of resources, lack of knowledge, and I'm sure every sterile processing professional has found themselves in a situation where they had to use their best judgment to figure it out. Just like you said, they drop off instruments they haven't seen before. And so you have to just make do with what you have. And so I think I would think it's usually not intentional that the deviations are occurring. And so that's where we need the awareness and the buy-in from other departments, other people to make sure that they're set up for success.
Yeah, absolutely. And if there was one best practice that you could come off of this episode with, it's to review these IFUs before you purchase. And I know that that's not something that you can just do in sterile processing or in the endoscopy department. It really has to have support from all of leadership and management, because it's the people who are purchasing these items that need to kind of stop the line before they're actually purchased. So that really takes a group effort, and it's not as easily said, that it's easier said than done.
If I could add too,
go ahead.
It's so important for staff and leaders to be familiar with your vendor policy too, so that we're holding vendors accountable for what they're bringing in, and we're referencing that policy and making sure that everybody has access to reference the vendor policy that exists. I know some sites are a little constrained with who has access to policies, but I think it's really important that all staff have access to that to make sure that they're able to hold vendors accountable upon check-in, even if they're bringing in a new product, what's been expected of them, so they feel confident stopping it before it even gets brought in.
Yeah, and that's a great point, because that requires you usually to also have a partner in the supply chain, because usually they are the ones who are kind of the owners of that vendor policy. And generally, they're the ones with the teeth of the policy. And if a policy doesn't have teeth, it might as well not exist because it's too easily ignored. But usually those vendor policies will have some sort of punishment or teeth that goes with it. And usually it's going to be that supply chain is the one who owns that. And so, yeah, like this, we already talked about, partnering with IP, but now you also need to be partnering with supply chain so that you know what's in there and you have a clear line to hold those vendors accountable for the times that they do drop things off that aren't authorized or have not been vetted, or they come in late or anything like that. Because as long as it's the person in Decontam complaining, chances are that goes nowhere. But if that information then goes to supply chain who owns this policy and is willing to enforce that policy, that's when things get changed.
I want to bring us around to another topic that I know people really struggle with. It's partnering with the OR. I can't tell you how many times I've seen those case carts roll in. Everything's dry, nothing's open, and nothing is transported right. It's just a giant cart of hazards. And so figuring out how to partner, again, I feel like this is a lot about partnerships, best practices, but how do we work better with the OR to make sure that those case carts come in a compliant way? They're all sprayed, pre-cleaned, packaged right, so that Decon can do their job more efficiently.
I think it's really helpful to walk in each other's shoes and have the OR come spend time in SPD and have SPD spend time in the OR. And to me, it's a great starting point for how to properly send things down. If you have the OR staff spending time in Decontam and seeing firsthand how their items are coming down, it'll make them take a beat and reassess before they send those items down.
And you took the words right out of my mouth, Katie. I mean, bringing them down, not only showing them the process and how challenging it can be if things aren't coming down correctly, but getting them education on it's not just about making it easy for SPD, but what their instruments can actually go through if they're not pre-treated and organized correctly, that the just tossing them back in the basket can damage them. The non-pre-cleaning blood will start to eat at the stainless steel. And in the long run, it's the OR that ends up not taking care of their instruments and why they're breaking.
Yeah, and I think that is kind of the key consideration that the OR has to understand, because oftentimes the mistake I see the OR make is, once they push the instruments out of their room, it's not my problem anymore. And what they don't understand is that every mistake you make on those instruments, it's coming back around because the instrument flow is a closed loop. So those instruments that you mistreated and didn't communicate, the mishandling or mistreatment of the instrument to SPD, that instrument's coming back to you. It may not be the next case, but at some point, those instruments are coming back to you. And so, again, when you have instrument shortages because, that really critical pair of needle holders that Dr. So-and-so likes, when they break, they're not available anymore. And, and so, again, like they are creating their own problems when they don't understand and don't respect the full circle of the process. And I think, to Katie's point, like helping them understand that next step is so critically important really does start with just getting them in there and seeing it.
It really is a partnership.
It is. It has to be.
Yeah, I think in my experiences working with a variety of hospitals, there's always the tense relationships between the OR and the SPD. There's obviously situations where they get along really well and there's great open communication, and that's what we want to strive for. But in the scenario or the circumstance where you don't have that open communication, that great relationship quite yet, what can be done? I would suggest that sterile processing take the initiative and try and figure out how to meet them where they're at and maybe go and observe and walk through and see what's going on with them. Because it's very easy to go to somebody else and say, hey, you have to come here and do this with me. But if you take that step yourself first and do the observation or open up the channels of communication, it's a small first step that it's where it's very likely that you can sort of have that reciprocity coming, after. And you say, well, hey, I came and saw what you guys are doing. Why don't you come down in here in Decontam and see what we're doing? And that could just be a quick, easy, practical step, especially if things are tricky. So,
I love that, Trevor, because you're right. Like sending SPD into the OR is also critically important because we need SPD to understand the end result of what they're doing as well, right? So, we're not just responsible for inspecting instruments for cleanliness. We're also supposed to be inspecting instruments for functionality. That's incredibly hard when you don't know how the instruments are actually being used in the OR. Right. And so I love this. It's almost like an exchange student program, right? Where you send us somebody, we'll send you somebody, and we'll just work on exchanging this information. But that's great, right? Because, to create that partnership that Jake just said, you have to start living in each other's shoes and being empathetic with what that next step in the process is.
Best practice that I have heard of, not nearly enough, but in a few places, is the surgeons will actually come into sterile processing and really see how difficult it is to process these instruments. And it creates such a better environment for those places that really get that push from the surgeons to process faster. And then that creates this, a waterfall of skipping steps and doing things faster, because you really, of course, don't want that. But when the surgeons really come in and see what goes on in sterile processing, it really changes the game. And I think every facility, clinic, everything should be doing that. But it's, of course, harder than one might think. But if you just had a couple surgeons start doing it and then they can talk about their experience, then others would start doing it too. But that truly is a best practice and can really change the culture.
Something else that can be forgotten or sometimes uncomfortable, but I think necessary to improve, is real-time feedback also. So if you're getting something in Decontam, calling the OR and saying, hey, my trauma set is still completely assembled, not sprayed. And then the same for the OR to provide real-time feedback to sterile processing so we can all work together to improve process gaps that we have.
Yeah, one tactic that I've seen that's kind of in line with what you're talking about is decontamination audits, where sterile processing is responsible for somebody like a supervisor or something like that to come through and look at the sets as they're coming in from the OR and actually go through with a checklist and say, was it, assembled before transportation properly? Yes, no. Are the delicate items separated out and put in their containers if they have them? Yes, no. Were the instruments pre-treated? Yes, no. And it kind of creates a checklist scorecard that you can then turn around and hand back to the OR and say, here's how you're doing. And there's a great saying in process improvement, says what gets measured gets fixed. And if you aren't measuring deviations from what the expected process is for point of use treatment and all those things, it will not get fixed.
And there's a lot of tracking systems that can help with that. But even if you need a manual process, checking down what services, what trays, take pictures.
Mm-hmm.
If the physicians aren't coming down to you to see how things are coming back, maybe you send them a picture of their specialty trays and how they arrived. Bring the information to them.
Yeah, I'm glad you brought up pictures. I'm a huge fan of pictures because it is one thing to say, hey, these instruments all came down in a mess. It is a totally different thing to show somebody a picture of what it looked like. And if you're in sterile processing and you're thinking about nothing other than just being defensive, having a good selection of those pictures is really helpful for when your finance person calls and says, why are we spending so much money on repairs? And you can send them a whole bunch of pictures and say, this is why. And you've got pictures of Bookwalter posts put on top of rigid scopes, and it's like, hey, this is the problem.
I want to talk just for a minute about PPE, since we are talking about Decontam. And along with PPE comes the topic of hand hygiene as well. So I want to kind of cover both of those things because they, of course, are near and dear to my heart as an IP. So I want to talk about compliance with both and why this can sometimes be such a struggle in the Decontam area. What is going on here?
I'll start off. I think often departments are designed with different goals in mind that are older facilities. So sometimes the layout of the department doesn't allow for proper hand washing and PPE donning and doffing flow. So if you're walking into Decontam past a splash zone just to get to your PPE or to wash your hands, sometimes that workflow doesn't accommodate best practice. So a good first start is to look at how can we change the design or where things are located to help improve compliance, especially with hand washing. I think in Decontam, people think it's not as necessary because they're already in a dirty area, but making it as easy to follow as possible and having it, often I even see that there's not a garbage bin right by the door for people to doff their PPE. And that's just such a simple thing to add to compliance and to decrease the risk of cross-contamination.
Exactly, Katie. And there's a lot of technicians that don't know what they don't know. And they walk into Decontam and it's often very hot. You're physically moving around. The sink water is warm and they get sweaty and they don't want to put on all of that appropriate protective equipment. But it's so crucial because what you're working in is going to get on you. And even if you are fully protected correctly, it can still, aerosolize or splash and get in, where the protective equipment isn't exactly covering. But raising awareness, and some things I've seen is that some departments aren't utilizing equipment that's actually rated appropriately, like examination gloves that really should not be in a Decontam that's going to let water seep through, or gowns that aren't rated properly. And that worries me a great deal because I don't want to bring all that stuff home with me. I want it to stay in Decontam as best it can.
Yeah, absolutely. And just a quick fact, per the AAMI PB70 guidelines, your gown must be at least rated a level 3 for any Decontam area. And last season we did a whole episode that focused on gowns, and we really encourage people to put in safety reports or incident reports, whatever your hospital does, if you're getting strike through or your gowns aren't working, because that's a safety issue for you. So if your gowns either aren't rated correctly or they aren't working, then don't continue to put yourself in a compromised position at your workplace every day. So that's something to keep in mind. And one thing that I see a lot is the hand hygiene isn't where it needs to be. If you don't have a dispenser where you're doffing, you're not going to clean your hands when you take off your gloves, which is required every time. You should be cleaning your hands before you put on your gloves every time. But if you don't have hand gel nearby, I guarantee you people aren't going to do it, because people are only going to do things that are easy for them. So you have to do it, or you have to have the supplies within arm's reach of whatever task is being done. So the supply location is really key in Decontam, and sometimes that's never even thought of when supplies are put out.
I've seen with gloves too, where they're so thick. The appropriate gloves are so thick where staff do not want to wear them. So then they'll develop side processes where they just double up the thin gloves that aren't protective or too short. And that contributes too. So I think on the front end, even making sure that you're getting products in that feel comfortable for the team, that they like using and want to put on and be compliant. Even face shields, I've seen some where they're just not comfortable. So then staff aren't wearing them. They're pushed up where they're not even being effective anymore.
Yeah. And I've seen quite a few people with those short gloves, and they get that sink enzymatic water into their sleeves and rashes start happening. It burns. It's no fun for anybody.
It's amazing to me that people are still using the short gloves when they're putting their hands into a sink of water, chemicals, organisms, whatever. I don't understand where the thought process is there with product selection.
Well, I mean, I think that's the key, is it's not there. And so no one has asked this. No one's talked about this. And to your point, Jill, I mean, like this is an OSHA requirement. These are legal requirements. And so if you don't have equipment that is fit for the task at hand, that is potentially a legal violation. And so those things need to be brought to the attention of whomever is in charge. And I think regardless of what aspect we're talking about, whether it's the availability of the PPE, the availability of the hand washing stations, these are engineering controls they have to be in place in order to facilitate compliance. And if we make compliance more difficult, chances are it just doesn't get done. And so we have to set technicians up for success. And that means making compliance easier rather than harder.
So, and I love that, making compliance easier rather than harder. And we all want to have those specified AAMI rated gowns. And there is a process for that. But one of the questions I've gotten a lot of times is there a regulatory standard, like a rating for gloves? And I don't think I've seen one, but maybe I've missed it.
So I can kind of answer that a little bit. Gloves are typically rated based on their thickness and mils. And I do believe there is some distinction on what is the required thickness based on your risk. And so those exam gloves are, to your point, incredibly thin. And then, of course, their cuffs are typically very low. So they're not made for deep sink cleaning. And so, again, do you have the equipment that's fit for the task at hand? And if you don't have the equipment fit for the task at hand, you're not going to be compliant.
Yeah, great point. As we start to wrap up here, guys, I am going to have each of you give a quick tip, a go and do for everybody listening that they can potentially put into place today or go and do to improve their decontam or put a best practice into place that they can feel good about, that they can quickly do today. So I'm going to just go around my screen, which, Jake, you're first again. So, Jake, if you could give us a quick tip for everybody that they can go and do today to improve decon.
If I was going to go into a new department that I was going to work in, my first step would be to go outside of Decontam and evaluate the PPE that's there, making sure that you have all the pieces that you need, but also that they are the right ones for the job, that it's the right rated gown, that they are the correct gloves, that everything is where it needs to be.
That's a great one. And I commonly tell people it's very easy to go today and look to see, one, do you have at least a 3 rated, AAMI rated gown? That's easy to tell. It's a little harder sometimes to figure out where the critical zones are of that gown, because what I have also found is sometimes that gown was rated a long time ago, and sometimes those critical zones have changed from the current PB70. That can be kind of like phase 2 of your investigation, but easy to do today. Go see if your SPD has at least a level 3 rated gown. Katie.
I think a good place to start is cultivating those relationships with your infection prevention team, supply chain team, and making sure you're vetting IFUs prior to bringing products in. That'll help so much with IFU compliance and with your staff productivity.
Yes, great. And just another piece of advice, if you're working in SPD and you don't even know who your IP team is, just invite them down. Sometimes it's intimidating for a newer IP that maybe they don't know anything about SPD. Just invite them to come do a tour, to shadow, observe. If you're an IP and you're nervous about SPD because that's not your specialty, just ask if you can come hang out in SPD. It doesn't always have to be a formal audit. Go spend time there and get to know the people so that you have, again, a good relationship. It doesn't always have to be you're there with your clipboard and your checklist and you're doing, a formal observation. All right, Trevor, what do you got?
Yeah, I think both of those are great options. And to kind of piggyback on what Jake said, making sure you have the right PPE, from my perspective, I would recommend you do a brush assessment, a cleaning brush assessment, to make sure that you have the right cleaning tools. Because if you don't have a brush to clean the item, how are you supposed to clean it? And I've walked through hundreds of hospitals where people have, from my perspective, gaping holes in terms of the lack of inventory or the lack of cleaning tools available. Either it's too short, it's too, the bristles are too big, so they're jamming them down in there, or it's not big enough, which obviously isn't going to clean a channel or a lumen. And so I'm sure whoever your vendors are, your brush vendors, reach out to them and ask to look at what you currently have available, and if that is appropriate, if you have the right set of brushes to cover all the instruments that you're doing.
That is such a big one. And stay tuned for later this season when we have a whole episode on brushes, because it's such an important topic. All right, Michael, you're up.
Yeah, if I could shout out an amen to Trevor's suggestion, I absolutely would, because you have to have the right tools. But if I had to just start one place, it would start kind of like Katie said, with a partnership. But I would partner with IP and the OR to establish what the expectations are and be specific for how instruments are supposed to be point of use treated and then arranged and transported into decontamination. And I would educate the OR to those expectations, and then I would begin auditing and reporting back on compliance for meeting those expected criteria. So trying to get what those measurements are and making those measurements and reporting on those measurements. Because again, we got to set the decontamination staff up for success. And that begins with having the right tools, which we've already said, and then making sure that the incoming supply, which is those dirty instruments, is coming in a condition that is safe and set up for success.
Perfect. All right, guys, that about does it for this episode of Pathogens and PPE. Thank you all for being here, and we'll see everybody next time.
That was our roundtable episode on decontamination best practices. And Jill, I love several of the ideas that came out of this. And obviously, we're talking about a very broad topic, and there's a lot of things that we could have talked about. But I like the fact that the things that floated to the top, I think, really are the most critical pieces. And that is engineering controls to set up success, establishing expectations, creating partnerships, and making sure technicians have the training and the tools necessary to be successful at their jobs. And so it was a big topic, but I feel like we covered a lot of ground in a pretty relatively short amount of time.
Yeah, absolutely. And decon can be such a complicated and crazy area. So there's a lot that can go on. There's a lot that can go right too. But I love how you mentioned we need to make compliance easier. And that really goes for everything. It's for IFU compliance. It's for PPE compliance, hand washing compliance. So every day as leaders, we should be thinking, how can we make compliance easier for our staff? And I loved when Katie mentioned that IFU compliance really starts before you purchase a new item. I loved that topic. And really, it's so true. And you should get IP involved. It's purchasing. It's the SPD leaders, even the OR leaders. Everybody should be coming together to say, can we use this properly? Can we clean it properly? Everybody should be agreeing before something is purchased. You don't want to be there afterwards saying, you know what, it's impossible to clean after you've spent the money. So many great points that came out of this, so many great tips that people can go and do right now in their facilities to make things better, to make compliance easier. I hope that everybody enjoyed this episode and that you got some great tips from our guests. And we will see you next time for episode 8. Don't forget to wash your hands and keep fighting dirty.
Thanks for tuning in to this exclusive podcast series on pathogens and PPE. For more information and clinical resources to help you fight dirty, make sure to follow us on social media by searching for Beyond Clean and Transmission Control.